Aloha. Aloha. Good morning, everyone. Okay, we are now live on Facebook and recording. Wonderful. Aloha and mele kaliki maka kako. Welcome to Hawaii Care Choices Healthcare Talk Story. I am Tish Lopez, your moderator this morning. Huge mahalos to all of our dedicated participants that join every single month from January all the way to December. We see you and we're so thankful for you. Mahalo for joining us today. And we're so glad you joined us for our last talk story in 2022. Happy, beautiful, yet very rainy Aloha Monday. Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel. Simply by searching Hawaii Care Choices, you will pull up all of the 2022 talk stories, including this one. Hawaii Care Choices is also on Facebook, Instagram, and Twitter. Follow us to see lots of content, upcoming events, get to know our team, even event highlights, and our supportive community members, and hear about our patient stories. For those of you joining us on Zoom, your bottom of your screen should look like this. Please click the chat box and say aloha to everyone here and let us know where you are joining from. Also, let us know how the weather is where you guys are at, because Lani and I are cold and rainy. Kimo, I'm assuming it's cold. Well, it looks like it's a beautiful, breezy day down at the beach. You may ask us questions throughout the presentation by clicking the Q&A box at any time to submit your questions to our panelists. To those of you watching on Facebook Live, thank you so much for joining us, and aloha. Please use your comment box to say aloha and let us know where you are joining in from. Feel free to chat in questions as well as share your reactions with us during this talk story using your reaction buttons. We love to see the hearts, thumbs up, the care button, and even feel free to share this live video with your friends. We are also doing polls today. For those of you watching on Facebook Live, you will not see the polls pop up, but we definitely want to hear from you using that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month in 2023. Just email me, llopez@hawaiicarechoices.org, and I will send you the link. So polling is very simple. A brain teaser bell will ring, a question will pop up, similar to what you see on the screen. Make your best selection, no right or wrong answers, and submit your poll by using that submit button below. Just to kick things off, we are going to do an icebreaker. All right, up on your screen is the question. Would you rather climb a mountain, swim in the ocean, go on a road trip, or read a good book in your favorite spot? I usually want to go swim in the ocean or climb a mountain, but I think today, because of the weather, I would just rather read a book in my favorite spot, which is on my couch. So go ahead, put your answer right in there and click the submit button below. All right, I see we have other people on Facebook as well. Aloha. All right, I will go ahead and end the poll right here and share the results. So 50% of you said climb a mountain and 50% of you said go on a road trip. That is so awesome and super simple. You guys are great. Mahalo for participating in those polls. All right, let me switch my slides really quickly. I apologize. All right, at this time, I'd like to welcome our guest speakers for today. Joining us this morning is Dr. Kimo Alameda, Vice President of Business Development for the Hawaii Island Community Health Center. Dr. Alameda is a graduate of St. Joseph High School right here in Hilo and earned his doctorate in psychological, educational, and cultural studies from the University of Nebraska-Lincoln. He has over 20 years of executive experience in state and county government and has consulted with healthcare centers and hospitals statewide to improve their cultural competency and patient experience. Dr. Alameda is currently, Vice President of Business Development with Hawaii Island Community Health Center, who serves over 40,000 patients. He is also a licensed psychologist, a popular statewide speaker, and has his own youth athletic program. And He and his wife, Star, are proud parents of 7 children. Ooh, congratulations. Aloha, Dr. Alameda. So happy to have you today.
Thank you.
Next, we have Lonnie Weigert, who is striving to raise the awareness about palliative and hospice care and bereavement care in hopes to provide a world-class healthcare choices and solutions for all. Give a warm virtual welcome to Lonnie Weigert. Aloha, Lonnie. Oh, you are on mute, but that is okay because we'll get there.
Aloha.
There we go. All right. This morning, Lonnie and Dr. Alameda will talk story about palliative care, and Dr. Kimo will share his perspectives on what can happen when serious illness collides with drug addiction. As a licensed psychologist and a statewide speaker on substance abuse and addictive behaviors, Dr. Alameda will share tips on how addictive behaviors can be managed while living with a serious illness and how palliative care could help. I am so excited for all of you to be here. All right, friends, let's give a warm virtual round of applause for Lonnie Weigert sharing the secrets of palliative care.
Thank you. Mahalo so much, Tish. And thank you for those joining us this morning. Let's get right to it, the secrets of palliative care. And the reason I call this the secrets of is because oftentimes many of the physicians don't really know about palliative care. And that's why it's important for us to educate you on this today so that you can ask for it if you need it or if there's a family member that needs it as well. So what is palliative care? So first of all, I want you to know that to palliate means to ease, to alleviate, to soothe, to really make people more comfortable. And so it's specialized type of care. It's really going to focus on the relief, especially after any kind of treatment, say, such as radiation or chemotherapy. A lot of times people don't feel well after that. So it really focuses on that, boosting the quality of life, not only for the patient, but for the family as well, is really what palliative care is about. And it is about trying to give more information and education to people who are living with a serious illness. And it is good for people of any age, any age. So tell me, Tish, is there anything that we can share with regard to what palliative care intersects with possibly the dangerous drugs that are out there on the streets right now?
Yes, definitely. I have a question for Dr. Alameda, but I just want to say I'm so sorry for everyone. The chat was disabled, so that's why I didn't see anyone coming in. So it is enabled right now, Kalamai. But for Dr. Alameda, those living with cancer, congestive heart failure, who may not be receiving palliative care under the supervision of their physician, and maybe dealing with chronic pain, what kind of dangers exist in the community for people looking, for the maybe street painkillers or some relief?
Thank you, Tish, and welcome everybody. And thanks, Lonnie. That's a great lead-in, great question. So here am I, right? I'm the fentanyl task force leader for the island. And you talk about street pills, or street medication or street pain medication. I mean, this is what I'm trying to get the word out, you folks, and this is critical. Like, you cannot trust anything that's on the streets right now. I mean, we used to say this before, right? Like, I don't know, a year ago, or just general knowledge. Like, hey, you don't know where, you don't know how they're putting together those pain pills, right? Because basically the drug dealers are making it, or they're ordering it, but somebody's making it, and it's not a pharmacist or a certified scientist. And if it is a pharmacist or a certified scientist, they're probably hired by the cartels. So this fake medication is coming in through different areas, China, but mostly Mexico and the cartels, the drug dealers. They want to get you hooked and get folks hooked. And it's sad because when our seniors or people in general who have pain, and they cannot get it from their physician for whatever reason, maybe it's hard to get into the doctors to make an appointment. Maybe They don't have the transportation means to go to the, I don't know, pharmacy, get all kind of reasons. And so then, getting it from a friend who got it from somebody on the streets, super dangerous. Short answer, you do not know what's in there. And the research is showing, and I'm telling folks, I said right now, out of the big drug bust they had in Kona and the big drug bust they had in Hilo, toxicology reports find that up to 60% of those pills that they found had enough fentanyl to kill somebody. So that's the danger. And you kind of playing Russian roulette, right? So if it's not prescribed by a physician or a pharmacist, don't take it.
Yeah, definitely. Thank you so much. Wow, that is definitely heavy, but thank you so much for sharing that information. Back to you, Lani.
What I think is really great is that, Dr. Kimo is able to share with us on what happens when things are not controlled and being supervised by a medical professional. I mean, it really can go off the rails. And this is why it's important, if you don't have a particular program, please seek one out, because a lot of the times the doctors will provide palliative care, but if it's not top of mind for them, it's definitely going to be a secret, meaning you'll be the one that will reveal it for the physicians, and they actually really do appreciate that type of support as well. So with early care, which is really what we're all about here, is patients can actually live with good quality of life, not only for months, but they could even go for years. And so that's why the earlier people can sign up for palliative care, the better it is. And again, like I said, ask for it. The physician tends to focus on the disease, and palliative care team such as us, we will focus on the person. So the kinds of things that make that difference is, their emotional perspective, the other types of pains that they're dealing with, not only physical, but, there could be some financial concerns, other things that we're able to help them with. But for the most part, what drives the palliative care team is always going to be a goals of care plan. And that's something that comes specifically as part of palliative care. So that's really important. And the patient and families will receive the education on what to expect and their concerns with regard to the illness that their loved one or themselves are living with. And that's really, really important.
Dr. Alameda, I know Lani mentioned that we are focusing on the patient when they are on palliative care. So for a patient who is living with serious illness, who may also have been a previous substance abuser, what are some ways that the patient could learn to deal with or manage their feelings of addiction without relapsing to old behaviors?
Mm-hmm. Yeah, I think Lani brings up a really good point. Your palliative care team, here's the key word in all of that, is the team. I think when you're in pain and you're struggling by yourself, your probability of utilizing drugs that is not prescribed right or seeking wrong advice increases. But when you have a team of caring professionals, man, you just increases your safety by significantly. So that's the first point. The second point is you also get support. I think when you're stuck in an addiction, man, you burn bridges, right? So your circle of support decreases. But again, when you get a palliative care team or a team that's concerned about your health, man, you get natural support right there too. So yeah, I mean, hats off to the palliative care team. That in itself can solve a lot of problems. Two things though with your question. So number one, we got to start changing how we view substance use. So we don't use the term substance abuse anymore because addictions is really it's a brain disease. It's like heart disease, right? Nobody chooses heart disease, just like nobody chooses diabetes. So same thing. So like, with heart disease, I wouldn't say you and Big Mac abuser or you and bacon abuser. Okay. Right? You're not abusing, you and food abuser. No. So, right. So we got to change the way we think about addictions. It's really a brain disease. And it occurs anytime. Right? You eat a Big Mac, it's like heart disease, right? You eat a Big Mac today, Whopper tomorrow. all of a sudden you get heart disease. Well, you never choose heart disease. And just like addictions, nobody chooses it. That life sucks. So that's the first thing. The second thing is the word relapse. So we don't use relapse either, right? We use reoccurrence. Just like with somebody who get cancer, right? If you don't say they relapse to cancer, right? They reoccur. The cancer reoccurred. So again, a lot of the addiction work is is changing how we use words. It's the stigmatization, and it's basically we don't know when we go from not being addicted to addicted. And so when somebody's stuck in an addiction, the first thing to realize that, hey, it's a brain disease, because the brain doesn't recognize what flavor the drug, whether it's meth, heroin, what makes alcohol, nicotine, marijuana, and then harder drugs like meth and opioids addictive is that it mimics something in our brain that we already produce. So again, the brain doesn't care what flavor the ice cream. It's gonna stop producing that natural chemical, whether it's an endorphin or adrenaline that makes us already feel good or eases pain. When you continually take drugs from the outside, you shut off that part of the brain that produces those natural chemicals. And when you shut it off, then the brain expects you to go get it from the outside since you've been getting it from the outside, right? And that's called craving. And then the addiction can come soon after. So another thing to remember is that there's a difference between dependence and addiction. So dependence is really an increase in tolerance, but somebody can increase their tolerance on a drug and not be addicted, because addiction is a DSM-4 definition, and addiction includes things like relationships, like impaired social relationships, or like it's basically a checkoff. So somebody can be dependent on a drug but not addicted according to the DSM, and that's an important clarification to make too. So how you help somebody who really stuck in an addiction, which is kind of like this, you go from I like it to I want it to I need it. And this is how I share the path of addiction with the youth, right? Because kind of complicated. So I just say, hey, a couple Trulies, hey, you like it, maybe some Heineken. And then after a while, you go to I want it, right? And then when you're in the stage of I want it, whether it's pain pills or it's, marijuana, that's kind of dangerous now. Now you're on the edge of the cliff, because if you don't control yourself, then you're going to jump into the stage of I need it. And when you're in I need it, that's dependency. And usually what follows dependency is addictions, because then when you're in I need it, you start not going to school. You start not following up with your important appointments, right? And then the checkoff on the addiction in the DSM-4 becomes a result. So what you need is you need to get help quickly. When you feel yourself in I need it, talk to anybody you trust. And right now the best evidence is really the 12-step program. It's like the oldest program, but it's the best. Evidence has shown that you talk to somebody, other people who share the same concern, and you take that one day at a time, that big book, right? That 12 steps. And it's very interesting because each step is like a major hurdle that you can overcome. And when you get to the 12th step, which is giving back and becoming a sponsor, and then it's one day at a time kind of thing. So they really have that's a really good thing. And so, there's meetings that you can go on island, but there's also meetings you can go on the online. There's something called In the Rooms, which is like 130 plus meetings. You could just jump on any kind of a AA or NA meeting, and kind of get that same result online too. So there are resources for folks. But I hope that helped. We kind of long-winded on that one, but I just wanted to clarify some terminologies and stuff, and I can be open to questions later on as well.
Absolutely. Thank you so much, Dr. Alameda, for that. I'm typing in my own notes as well, because we also need to change that, right? We want to change the stigma. We want to change our language to it. So I'm definitely going to be cognizant with that, especially talking about today. But we're so thankful that you are able to give us these little tips that we can even change our own thinking of how everything is, right? All right, Lani, back to you. Sorry if you had any questions for Dr. Alameda too.
Oh, Mahalo, Dr. Kimo, because, helping us put things in the proper context is really important because, the power of the word is very important. And I think that trying to switch the stigma over to that it's a brain disease is, it puts it right there where we can deal with it better straight, full on and understand it more. And why I think that this is so relevant in you sharing this with us is because, the majority of the people that we're dealing with are quite elderly. However, there's always others in the household. And, when our team goes in there, the fact that they would understand all of these other possible cautions that they have to take a look at, especially if there's teenagers in the house, etc., you've really helped us pull in more information on that. And that's largely relevant to what we're doing as a team to support not only the patient, but the entire family as well. So this is really relevant. And I appreciate that you added on these other things so that even the way that we refer to this is changing. And I think that it gives it a place where we're able to deal with it head on, instead of it's something that happens in the back room and we don't really want to talk about it. It really puts it up in the front row. So thank you again. So the serious illnesses that happen with regard to palliative care are these that are listed on the screen right here. And there are more, obviously, other illnesses that we deal with too. But really, right off the cuff, these are the top ones that people are dealing with, not only in our community, but across the nation. And so it's very important for people to realize that there is help very, very close by. And the reason that these particular illnesses are stated here is because we find that they really do affect the activities of daily living, as well as the quality of life for the individuals that are living with them. And we really try to come in for the team to support not only the patient, but the caregivers too, because we often find that without support for the caregivers, many can get sicker than the patient themselves. And, sadly, there have been incidents where the caregiver actually passes before the patient, and largely it's due to no support at home.
Definitely. Dr. Kimo, we're talking about individuals who are living with serious illness. And so, those who may be seeking relief from chronic pain or emotional stress, naturally, when they're on palliative care, we have that team of support and their physician oversees their medications. But can we talk a little bit about, in the wrong hands, what are some of the dangerous drugs to really be aware of?
Yeah. Well, first, any drug's a dangerous drug. Again, the brain doesn't know what color, what taste, the flavor of the ice cream is, right? So any drug can be a dangerous drug because it can make our dopamine reward system naturally shut off. And then that's how dependence and addiction lead to. So, but yeah, I mean, talk about caregivers, right? So, my dad was a caregiver for my mom who had Alzheimer's, right? And then he was stressing out. So his vitals was worse than my mom's, and so back to Lonnie's point, and so somebody who's stressing out, I mean, when you hear about an opioid, and the effects that it can provide to you, so again, here goes, hats off to the palliative team again. When there's a team of professionals, asking questions, because even the caregiver might end up wanting to take some of that medication that their loved one is taking, just to ease some of the stress. But also in the wrong hands, yeah. I mean, anybody who has a history of substance abuse shouldn't be, because the temptation is there. And so, again, this is where the team would be helpful to kind of assess that. But you got to know that, our country is, the United States of addictions is kind of what I call our country. And because, we only represent about 5% of the world's population, but we consume 95% of the world's opioids.
Wow.
Okay. And another statistic, according to the National Institute of on Drug Abuse or Drug Use, is that the United States uses 75% of the world's prescription drugs. Okay, period. Again, but we're only little under 5% of the world's population. So drug addiction is rampant in our country. What is the central defining feature of America? It's not McDonald's or cows or, I don't know, cars. It's drugs. We get more liquor stores than supermarkets, and then our supermarkets get liquor stores. Okay, so I mean, it's a central feature. So we gotta really kind of be cognizant of addictions, and it can happen to any one of us if we're not paying attention. I like it, I want it, I need it. There are many drugs that could be harmful to seniors or older adults, and there's a list on the internet. It's called the Beers list, BEERS. It lists the harmful drugs for the elderly. The adverse effects. It kind of lists this out because there is an increase of falls for older adults. Because of the drugs, and falls are the kind of like the number one reason why seniors end up in the emergency room. And when there's many different types of drugs, like 6, 7 of them, somebody got to make sure they're tracking that. Pharmacists don't usually volunteer, to track it. Not even primary care physicians don't volunteer to track it. And the Beers list also talk about harmful drug interactions. Okay, because somebody got to be on that, right? They got to be on those 6 or 7 medications that your loved one is on. And again, this is where the palliative care team can come in very handy because they know that. And pain medicine is a relatively new science, like 10 years. It's been around for 10 years. So you need that expertise on the team to kind of make sure that you're not taking drugs that have bad interaction effects. Also, addiction medicine is a very new science as well. It's been 5, 6 years. Fortunately, I get the opportunity to spend 2 to 3 times a week with this guy, Dr. Kevin Coons, who's an international expert on addiction. So that's how I've been learning about it. So yeah, I mean, you got to kind of monitor them. This is where the palliative team comes in handy, like who in the home can be the administrator of these medications, making sure that they're legit, making sure that they're stable. Also, when a loved one passes, right, you get all that Vicodin, all that morphine that's left in the cabinet. The palliative care team will make the family aware. I was like, hey, by the way, better you give that back to your primary care physician, or let us take that back. No, leave that in the house for a rainy day, okay? Because one teenager or somebody stressing out who go on the internet and learn about the euphoric effects of these drugs, right? They're not taking them for pain. They're taking them for calm their nerves or for eliminate the stress. Wrong reason, all right? Your palliative care team can be there to remind the family, bring back those drugs, return it to the pharmacist or to your primary care physician. So those are just some thoughts. I leave with you, Tish. Thank you for the question.
Definitely. I do have a second follow-up question to this. So we've talked, mentioned about caregivers and caring for the patients and the patients who may have these types of things on hand. If a family member, like you were saying, if somebody in the household suffers from addiction, can you just tell us some of the precautions that you might advise the patient or the caregiver or even the entire family to keep everyone safe?
Yeah, I mean, first and foremost, you got to check your cupboards. If somebody suffers from addictions, the first place they're going to look at is the medicine cabinet. And I would keep a close watch on that. Secondly, again, understanding that it's a brain disease, that if they're stuck in I need it, that they didn't really choose that path. Just like with heart disease, if we knew that second Big Mac or that Whopper just took me over the edge to get heart disease, maybe we wouldn't have eaten that Big Mac, but we don't know because we don't know how our brain works. So if somebody is stuck in I need it, you got to have compassion, because right now that their dopamine reward system, that natural feel good chemicals has shut off. And so life sucks if they're not getting that feel good from the outside. So if we can make them aware of that, let them know that there's help out there, if they can talk about it with a trusted person, and they gotta have hope.
Yeah.
You know, and my definition of hope is hold on, pain ends. Okay. When people feel like they get hope, usually it correlates really strong with effort. When people feel hopeful, they're gonna try. When they don't feel hopeful, they're not gonna try. So we gotta continue to inspire those to hold on to, you know, to tomorrow's another day, one day at a time. Days make weeks, weeks make months, you know, and that's why you hear people like, hey, I've been like 10 years, 12 years, you know, 23 years, you know, and every time they get their sobriety birthday, they get a little pin or an acknowledgement from the 12-step program, because it's tough once our brain switched to an kind of addictive, dependent mode. It's tough to rid ourselves from that, but it is possible, and there is help out there. Thank you for the question.
Thank you so much, Dr. Alameda. We're so happy to have you on to just explain all of these things. And yes, help and support is out there. So please reach out if you need. I'm going to do a quick pause on our talk story right now to have a tea. All right, so the question up on your screen is early patient sign up ensures more support and quality of life for all. Talking about support, talking about resources, there is definitely help out there. So just let us know, true or false. Those of you watching on Facebook Live, you will not be able to see the polls pop up, but please let us know if you think early patient sign up ensures more support and quality of life for all. Just put it right there in the comment box. I'm going to go ahead and end the poll right here and share the results. Absolutely, 100% of you said true. Early sign up ensures more support and quality of life for all. Thank you. Thank you so much. We'll go right back into our slides here. Back to Secrets of Palliative Care. Go ahead, Lottie.
Thank you. And mahalo again, Dr. Kimo, because the comments that you gave, it just solidifies all of the efforts that we're making on the palliative care side. Particularly, yes, if there is a patient who has maybe other family members that live in the home that may be dealing with this brain disease, our palliative care team does take extra precautions to ensure that everyone in the home is going to remain safe. And definitely, if there's a passing of one of our patients, the immediate protocols kick in with regard to taking care of all the controlled substances in the house. So just want to let everybody that's on the presentation today know that all of those processes and procedures are definitely in place to make sure that everybody remains safe, even after the passing of the patient. Now, with palliative care, it's very important to share that we want the patient to be at the center of all of this control. So by doing that, we are trying to find out from the patient, you know, what is important to them in life. And it's very, very clear to us that when they share that with us, there isn't anything medical about it. There was a case in point that we had a young person. She was 21. She had just gotten married. Actually, she was becoming a doctor, and she was diagnosed with cervical cancer. Anyway, immediately the doctor, like I said, the doctors are always going to try to focus on the cure and the disease. And the doctor immediately told her, okay, well, we'll schedule you for surgery this week. You come in, you know, we'll take care of it. Well, she, you know, being a newlywed at the time, she was very concerned with going and having some major surgery. And so she happened across a palliative care social worker who then asked her, what are your goals in your life? And that's when they were able to share and discuss. The woman shared that she is a cyclist. She likes to do marathons, and that is really part of her lifestyle. And it was then revealed that had she gone through with the surgery, she probably would never be cycling again. And so these are the kinds of things that are so important with regard to palliative care and having a team that is supporting and really providing additional information so that, choices for the patient and the family, the best choices can be made. Because oftentimes, in medical care, a lot of things are offered, a lot of options are offered. Not all of them do we need or do we want, but we don't know that because we're just being told this is what you get. This is the difference about having a palliative care team. Also, just like Dr. Kimo was sharing, that with regard to medications, with a palliative care team, there is an overall focus on what is being provided for the patient, because it's exactly as he said, nobody is tracking all of the different medications that are coming. So say the primary care physician is prescribing some type of medication. However, the patient has some kind of incident, heads over to urgent care, gets another prescription, and then goes to see their cardiologist or whatever ologist they're seeing, and they get more medication. And then, all of a sudden they need to go to the emergency room and they get some more medication. There is nobody that is tracking all of that. And in fact, sometimes the medication counteracts each other. And so that is very dangerous and can also affect the quality of life for the patient. And we find with the care team, one of the basic components of palliative care is to make sure that there is a medication review going constantly throughout the care of the patient to make sure that there isn't all of these medications that are just being taken haphazardly. Meaning a patient may come on to palliative care and be taking maybe as high as 21 different medications. However, after the palliative care medication review is done and the primary care physician is looped in, maybe there's only 8 medications that are needed. And what happens is we see that a lot of the discomfort goes down by another 5% just by aligning that medication. So like Dr. Kimo was saying, it's really important to have all of that under the supervision. And we find that when families understand what's going on with the medication and the care and the expectation, there's a lot of anxiety and depression that is immediately cut off. And so again, palliative care makes sure that the patient is at the center, that their goals and values and priorities are number one, and that unwanted and unnecessary treatments or even medications are also kept at bay when palliative care is driving that program.
Yes. I'm going to take a moment, Dr. Alameda. I know we're talking about the support and the help and the resources that are out there for people on palliative care, for people on hospice care. The medication review is so great. But, on the opposite end, we know that there are people who may not be on palliative or hospice care who are still living with serious illness or advanced illness and pain, insomnia, anxiety. What can they do if they, take an illegal substance and overdose? Is there any help, some light on that?
Yeah.
Yeah.
Unfortunately, one person every 11 days dying on this island from an overdose, mostly associated with fentanyl. Now, these are not those who are in palliative care, I can tell you. These are those who are addicted to pain pills, dependent on it, and then addicted. Right, so now they're looking for it, and right now fentanyl is the major issue because it's cheap and it's being snuck into meth, cocaine, and heroin. And so those one person every 11 days dying, mostly are already somebody who is already stuck on a drug, one of the above. But every once in a while, why I'm talking to the schools is because every once in a while there's an innocent kid who's at a party drinking. Maybe they're all, drunk already, and all of a sudden they just engage in maybe sniffing a line of cocaine or something. And the chances of fentanyl being laced in there is really high now. That's why it's a national epidemic. So, like I mentioned, one person every 11 days dying, but 3 people every 11 days are being saved by the use of what we call Narcan, which is an opioid overdose reversal medication, and it looks like this. So it comes in this box. I don't know if you can see this box, but because of my, let's see. Okay, yeah, this. So in a box, there's two of these packets. So you peel it, and then you take it out. All right, it looks like that, and then you place it in the nostril. Any nostril, doesn't matter, and then you press it. You press it. So peel, place, and press. You wait 2 minutes, and every box there's two of these, because once you use it, it's done. You wait 2 minutes. If the person don't come alive or don't start to breathe again, then you give them a second dose. And if it's an opioid overdose, 99% of the time they'll come right back alive. You know, it's amazing. And how we know this statistic, because this statistic is on this island, because the fentanyl task force also includes our fire department, police department. So every paramedic, when they go out, in fact, in the last 135 calls, right? People call the paramedics, they respond. 135 calls of unresponsive, people, individuals that. So of course, the first thing you do is the unresponsive. So you call 911, right? Right? And then you wait till the paramedics get there. So this is how awesome this thing is. So out of 134, they had 40 people who responded positively to Narcan, which means out of every 10 unresponsive individuals, 3 individuals respond positively to Narcan. Yeah, we waste 7, administrations of Narcan, but we saved 3 lives. That's major. So what you can do to answer your question, if somebody's unresponsive, they're overdosing. Now here's the deal with an opioid overdose, different from a meth overdose. Okay, meth is they're dying because their heart's just beating, 200 times a minute, and then the blood and the heart cannot pump correctly, so they just get cardiac arrest. Okay, on an opioid, it's a downer. So the downer, their heart just beat 100 beats, 70 beats, 60, 50, 40, 30, then they just fall asleep. They don't know they're dying. That's the problem. That's why they cannot save themselves. That's why every household, if you get pain medication, should also have Narcan available. Okay, so that when somebody's unresponsive, hey, call 911. You give them Narcan, just like how I said, peel, place, and press. You wait 2 minutes, give them again. Because maybe the kupuna or the loved one that you're taking care of, maybe they doubled up on their medication. Maybe they took one medication, maybe they drank alcohol, some kind of bad combination effect, and now they're not responsive. So super important to have Narcan available, and we've been distributing Narcan for free in the community. About I think it was last week Saturday, we gave out 689 boxes, because you can get them at Long's Drug, but cost about $100. Okay. With insurance, you can get them for $75, but it's still, expensive for some people. So we've been giving it away for free. And, we might be giving it out again. Just, pay attention to your radio. And if we do give it out again in Hilo, I will send Lonnie and Tish a flyer to keep you folks aware. When we give it out, it's a drive-through. So cars just drive through. We just share the peel, place, and press. We give them some instruction sheet, and we give you a box, and you drive away. So it's pretty anonymous.
Wow.
Thank you Tish, for that question.
Yes, thank you so much for sharing that. That is awesome that this is given for free. This Narcan is given for free, but also available in stores if anyone needs. So thank you for that. It's amazing how many lives are saved through that. So that's definitely a good thing. All right, Lonnie, back to you.
Okay. So yes, continuing on that, in the overall umbrella of palliative care, it's a very, very big umbrella, by the way. And a subset of that is called hospice care. And so a lot of times when people are going their natural progression of their disease, many times they elevate to a point where they need additional care, and hospice care is already there. The transition is quite smooth and very, very comforting to a lot of patients and families when when it's time that the patient requires hospice care, we're already there, and we're able to reduce a lot of that anxiety and depression that comes along with the deeper sides of healthcare. And so anyway, what's nice about having hospice care not only is all of the different medical equipment is provided, etc., but also that there's a lot of volunteer support and there's respite care for the caregiver, which is very important because a lot of the caregivers, they definitely need a break. And now on the Advanced Healthcare Directive, this is probably one of the greatest gifts that anyone could give their loved one. And that is by having an Advanced Healthcare Directive done. So the Advanced Healthcare Directive is a direction provided to anyone that is in the family when somebody in the family is unable to speak for themselves. So say somebody got into a car accident yesterday and now they're up at Hilo Medical Center, but they're unable to speak for themselves. The Advanced Healthcare Directive would then help all of their loved ones know what mom or dad or brother would want because it's already written in their Advanced Healthcare Directive. And so our very good friends at Community First Hawaii provides this information for free, and that's what's listed right here on this flyer. So if there's anyone who is, of course, not on any of our programs, because our programs would definitely include the Advanced Healthcare Directive, please go to our very good friends over at Community First Hawaii and get yours done or your loved ones done as well. It's, like I said, one of the most precious and valuable gifts that you could ever give to your family. The other thing too is there could be a question of a post form as well. And a post is a physician order. That is different from this. And that is in fact a physician order. And many people will have it on their refrigerator, etc. So say if there is an incident or emergency that happens at their home, they are able to pass over the form to the ambulance team that comes there, and then they will follow that directive, that order from the physician as well. Thank you, Tish.
Awesome. Thank you so much, Bonnie. I did put the registration in the chat for anybody that wants to go ahead and click the link, or I hope you all caught that QR code. Back to you, Lonnie.
Thank you. And now the highest level of care. This is hospice care. This is the Cadillac of services. For those living with advanced or terminal illness, there is nothing more than this. I mean, the amount of robust services that anyone is able to receive when they are on hospice care is really incredible. Now, at this point, if anybody transitions to hospice care, they're no longer going for treatments anymore. Now it's really about comfort-directed care that is provided to the patient, and there's all these services that are provided to help the families as well, because it really is about supporting everyone in there. Now, sadly, what happens is people will contact us, in the last few days of life when, unfortunately, we're unable to really help the family. We're probably able to get the patient comfortable, but it takes some time to really build the resilience and tolerance for family members to anticipate the loss of a loved one, and that does take more than a few days. And so I tell people, do not hesitate. If your loved one is able to qualify for hospice care, by all means, definitely sign up for that, because the amount of care that the entire family will receive is really amazing and incredible. Tish?
Thank you so much, Alani. At this time, I'm going to just pause. I see comments coming in and I will read those in a minute, but we have our brain teaser. So up on your screen is the question, how is palliative care and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves quality of life for patients and their families, or all of the above. Again, for those of you watching on Facebook Live, we're so glad you joined us here, but you will not be able to see the question. So please pop that right into that comment box. How is palliative care and hospice care the same? And go ahead and put that right in there. No right or wrong answers, and click submit. I will end the poll right there and share the results. So 100% of you said all of the above. Absolutely. Thank you so much for engaging in our polls. I'm going to go ahead and change our slide over here. Dr. Alameda, we have a comment that says, I appreciate hearing statistics, and I know that we have an addiction problem here on the island, but hearing the numbers just raises so much more of the awareness of what's happening on our island. So thank you so much. Another comment here is from Nick. Aloha, I assist with Community First Advanced Healthcare Directives program and wanted to share that the dates for the first session in 2023 will be posted online very soon at our website. And we put the website right there that you can click on it, copy, paste, save, however. But yes, as Lonnie says, this is a beautiful gift for your families. So, and it's a great resource and support that we have in our community as well. That's completely free. All right. Back to you, Lonnie.
So thank you so much, Tish. And thank you for all of those who are dropping in comments. We really love hearing them from you. Now, one of the really big important parts about receiving palliative and hospice care is who pays for it? How does it get paid? So for the most part, insurance plans will cover most of the palliative care coverage, especially if there's Medicare and Medicaid at the same time. There normally is no copay at all. The copay would be similar to when you go to see any of your specialists, your cardiologists, et cetera, because palliative care is considered specialty type of care. And for hospice care at home is 100% covered by any and all insurances, including Kaiser, the VA, et cetera. And hospice care can also be provided at nursing homes and residential care homes as well. Back to you, Tish.
Thank you so much, Lonnie, for sharing all of that on hospice and the secrets of palliative care. We want to let everyone know that you have access to quality care today. Call your physician, ask for palliative care or hospice care, and see if that's right for you. You can call us directly 969-1733 Monday through Friday, 8:30 to 4 p.m. You can also email us at care@hawaiicarechoices.org, or you can visit our website, hawaiicarechoices.org. Thank you so much for our audience for listening in this morning on our Healthcare Talk story. A special mahalo to our guests, Dr. Alameda and Lonnie, for just sharing your valuable insights, the statistics that are out there, and the resources for support and care in our community. If anybody's dealing with addiction, or if they want palliative or hospice care, for all of that support. We are so grateful. If you have any specific questions about you or your loved one's situation, you can please call out to us as well. We're happy to answer any of your questions that weren't covered in here today. Again, the number is 969-1733. Our hope is that you get the right care at the right time. At this time, I would like to do a quick survey for those of you joining us on Zoom. There will be a 6-question survey that is anonymous that will come up on your screen. It's not going to be shared, but we would just love to get your feedback on our presentation today. Your input will allow us to gain a better understanding of how to best serve the community with presentations like these. Lonnie and I definitely read through all of them, and we take your advice. So rest assured, it is not for nothing, I promise. For those of you on Facebook, please send your thumbs up, your hearts, or share this again with your friends and family if you enjoyed this presentation. I am going to have that survey pop up for those of you who are on Zoom. It should be there. Please answer all 6 questions and then click submit button below. Everyone's invited to the fully engaged Zoom presentation next month by emailing me, lopez@hawaiicarechoices.org. At this time, while everybody's taking their surveys, Dr. Alameda, is there any last comments that you'd like to say, or just some resources, more resources you'd like to share with us?
Yeah, sure. There is a medication that really works well, and that is called Suboxone. For all opioid folks who are stuck on opioids, and trying to get off. Suboxone is kind of like a nicotine patch, but it's better than methadone. It's the best medication treatment out there, and that with therapy and a program like the 12 steps, that's the magic bullet to help folks who are stuck in addictions with opioids. Thank you.
Thank you so much for sharing that as well. So much support and help for all of these. Lonnie, is there any last comments you'd like to share with our audience?
Yes, I'd love to thank Dr. Kimo Alameda for joining us and for helping us expand and increase the awareness about what's going on the streets with all of these drugs out there. It's so sobering to hear the data that you shared with us on what is truly happening outside of palliative care and hospice, and when people are not supervised with their healthcare, how it could be a train wreck out there, and also to put us in the proper context of how we look at addiction and substance abuse, and that there are new terms for that, and how we are really guiding people to seek the help that they need during that time, and then in the end, how tried and true 12 steps still here is still making a difference. That is great to know that sometimes the old school is still the one, so that is really a beautiful thing. And I just want to thank you so much for helping us understand that there are all of these things that are going on, and how serious the situation is with regard to all of the street drugs that are out there. So thank you so much for joining us again.
Thank you so much. Again, a great big mahalo for all of our audience here listening in today. If you feel that you have benefited from this presentation, please let your friends and family know. They're welcome to join us every month, the 10th at 10. Unless like this month, the 10th lands on a weekend, then we'll do it the Monday after. But just keep an eye out. Feel free to follow us on Facebook and Instagram to get those updates. And if Dr. Alameda has any flyers, we will definitely be sharing that on our social media as well. So feel free. Mahalo again, everyone, for joining us. A hui hou, happy new year, because the next time we'll see everyone is in 2023. Stay safe. Mahalo.
Aloha, everyone. Aloha.